Good day. Dr. Jason Sala here with Heather Hurley. We're in the sterilization at Sala Family Dentistry. Got a few questions for Heather. So, Heather, how long have you been with Sala Family Dentistry?
I have been here for 19 years as an assistant and as an assistant team leader.
Sweet. So with that time, we also got to grow and we got to bring in design ergonomics, and then you got an opportunity to work for them. How long have you been with design ergonomics?
I've been a clinical trainer for 6 years with design ergonomics, and I absolutely love managing both of them.
And as a clinical trainer, they awarded you the Dental Ninja. And why is that?
Because I work in an office that I do the design ergonomic system every day, and then I can also go to other offices and teach them. And the benefit of that is that the team, the assistants, the hygienists really trust me because I actually work in an office that has it.
So when you get to put it in play in our office, and then you get to teach others in other offices, and you get to go around the country to do this, what's the best part of that opportunity for you?
I think meeting other offices and going in and they are so stressed out and unorganized, and then leaving and they feel like they can see patients the next day and work the system and be more confident. So why do you let me do both work here and with design ergonomics?
It's early morning. We haven't started our office yet today, and look at our sterilization. It's already set up. There's no way that if you go on the road to teach others that you would allow it to slide here back at home. So we get reinforcements of the foundation of why we have the visual restocking. That's one. Two, it gives you an opportunity to go out and see what other offices are doing. So we might get some pearls or something that we can bring back and put in our office. And then finally, what it really does is it allows you to have confidence knowing that we're doing it the best way, the most streamlined way, the most efficient way. And then you get to make sure that you're like comparing our sterilization practices against everyone else's, and you're like, ooh, we missed this. We need to improve it. And for me, that little tweak in the patient care improvement is so worth it to let you be able to go out. I love watching you grow. I love watching you become a more confident assistant team leader, because when you're in front of people, you're being challenged every day. And I think you've become so much more valuable as a assistant, but also as a wife to your husband, as a mom to your kids, as then a friend to others, because you've been challenged and you've risen to those occasions because you've been able to practice it. So I'm just super proud of the growth that you've had, and I can't imagine like if we didn't give you this opportunity, I think we'd be holding you back. And I love watching you grow.
Thank you.
What do you love most about design ergonomics, Heather?
Well, I'm an 8814 my Colby, so I absolutely love checkoff lists, being organized, everything being where it's supposed to be. So for me, it makes my job easier, and I found that my entire assistant team is also high fact finder follow-throughs, so they thrive in this environment.
That's awesome. Dr. Jason, what do you love? What's your favorite part about Heather?
The fact that we've worked together for 18 years and we still like each other.
Yeah.
She knows my nuances and my quirks, and she makes me a better dentist.
Okay.
So Heather, I got one last question for you. What does a dental black belt do?
Job, doctor, you don't want to get rid of your stuff?